There's a federal push to figure out what causes autism, but how to do it remains up for debate. The National Institutes of Health and Centers of Medicare and Medicaid Services plan to team up to build a national autism registry. It would gather data from everything from insurance claims to smartwatches, but local advocates and a father I spoke to have mixed feelings about the idea.
You try to put somebody on a registry and say, this is what this person is. That's a tiny snippet of who that person is.
Eric Kronecker is the father of 15-year-old Ashton Kronecker. Ashton has Down syndrome and is also on the lower end of the autism spectrum. He tells me he first noticed the signs when Ashton was younger, when he struggled with letting go of unfinished tasks. Eric says a registry would treat autism as a disease.
I really do take offense to what they are trying to do, in the sense that you're trying to limit my son, and you're trying to label him, and you're trying to make it a disease, not a disability.
The potential registry would use insurance claims, medical records, and wearable device data, focusing on Medicare and Medicaid enrollees, about 36% of Americans. Miles Hinckley, executive director of the Thompson Foundation for Autism and Neurodevelopment, spoke with ABC 17 News last week at a progress event to MU Healthcare's new Thompson Center building that treats patients with autism spectrum disorder. He says he supports finding the cause, but privacy is important.
But we're not in favor of doing that in a way that it either jeopardizes security, jeopardizes their personal health information, or jeopardizes that data in any way.
Eric says research should continue how it has been for years.
Because the research that the federal government does and the CDC and all those things, those are what we use as our tools and our resources as we're trying to do our own individual. Kennedy said it's on the parents to do it. Trust me, there's very few special need parents that don't do a ton of research and don't try to better their child's life.
The Thompson Center's executive director says data is being collected through research protocols to make sure privacy is maintained, but people are providing consent.